I'm Kathy Aikman, the Project Director for COVID Support Vermont. My colleague Kath Burns and I are so glad to be able to share with you information about Vermont's crisis counseling program, COVID Support Vermont. In this video, we're going to explain how COVID Support Vermont was implemented and by whom, the goals of COVID Support Vermont, information about disasters, stress, mental health reactions, and strategies for recovery. We'll also discuss COVID Support Vermont's services and goals, as well as information about how to find out more about our program. In March 2020, Governor Scott declared the state of Vermont in a state of emergency. This declaration made it possible for Vermont to apply for a crisis counseling program grant, whose main goal is to help Vermont citizens cope with the pandemic. COVID Support Vermont's crisis counseling program accomplishes this through education, emotional support, and connections to community services that promote resilience, empowerment, and recovery. We are funded by the Substance Abuse and Mental Health Services Administration and Federal Emergency Management Agency, otherwise known as FEMA. We're managed by Vermont Departments of Emergency Management and Mental Health and administered by Vermont Care Partners, a network of 16 designated and specialized services agencies across Vermont that provide mental health, substance use, and intellectual and developmental disability services and supports in your community. The grant term is about a year in length and will end mid-June of 2021. COVID Support Vermont's main goals are to assist individuals, groups, organizations, and communities with their mental health well-being as they navigate the impacts of COVID-19. We accomplish this in a few ways. We provide short-term supports to mitigate stress, coping strategies, emotional support, and linkages with other community-based agencies that support mental health and well-being, including other economic supports. Kath Burns, the clinical supervisor for COVID Support Vermont, will now go into more detail about the program.
Disasters are events that are natural or human caused that cause human suffering. This suffering creates a collective need that often significantly overwhelms local resources. COVID Support VT is here to supplement local resources and support people, programs, and communities. The COVID-19 pandemic is a different disaster experience. Unlike a point-in-time event, like a hurricane or a tornado, the pandemic is ongoing and lengthy. People are not able to see a clear end because its effects are widespread and pervasive. During Tropical Storm Irene in Vermont, people who live near waterways were directly affected in one tragic flooding event. With COVID-19, all are affected, even people tasked with supporting those living through the disaster. The pandemic has unfortunately increased and exacerbated existing disparities for people of color, people in poverty, and other groups, making these people more prone to negative health, mental health, and economic impacts of COVID-19. In addition to the clear health risks associated with contracting the COVID-19 virus, the negative effects of prolonged loneliness, isolation, fear, and stress are widespread and growing. But knowledge is power, and the more we understand these effects, the more we can support people to weather this difficult time. When we talk about recovery from a disaster, we're talking about the experiences people have across time, from when the disaster happens to when they establish new patterns and feel as though they have moved through the disaster event. As illustrated here, we can see a typical recovery timeline when, from left to right, groups experience the impact of the disaster, followed by a period of significant emotional highs and activity. People feel invigorated, if not overwhelmed, by what they need to do to manage the event. Typically what follows is a period of disillusionment and fatigue as recovery takes longer than expected and the full impact of the disaster, economically, emotionally, and physically, is realized. This period has many emotional ups and downs, and people experience setbacks and trigger events that cause them to struggle in different ways. But over time, individuals, families, and communities develop new patterns of living, often referred to as the new normal. In a typical disaster, anniversaries of the disaster are a notable time when people may experience emotional lows. With COVID-19, we might find that people experience many different anniversary reminders as they recall significant events of note to them, such as the death of a loved one, the loss of a job, or memories of prolonged periods of social isolation. Using this timeline as a model can help people understand their own process, give them hope that things will improve, and understand that their experiences are typical and expected. While there are clear health impacts to the COVID-19 pandemic, there are significant mental health impacts that we have yet to fully really understand. The Kaiser Family Foundation has been running polls of adults in the United States over the past year to understand the general impact of COVID-19 upon the mental health of adults. In this poll in March, they found that 32% of adults reported that their mental health was negatively impacted by worry and stress due to the coronavirus. This number significantly jumped when they ran the poll again in July to 53%. And all indicators are that this number has been continuing to rise. We also know that there are particular groups who are more at risk for negative mental health impacts due to the disaster because of their particular experience with isolation, pre-existing experiences of disparities and injustices, personal histories and exposure that make them more vulnerable to the negative impacts of ongoing stress, or occupying positions that require them to work in environments with potential exposure to the disease. Intersectionality here is notable. People more often than not fall into several categories, which further increases the risk for mental health concerns and stressors. We pay attention to the effects of the disaster upon stress and mental health because there are known direct impacts upon our overall functioning. We know that there are a variety of physical symptoms people experience when under stress that include headaches, gastrointestinal issues, and chronic fatigue, to name a few. People can also experience a variety of emotional reactions, sometimes within a short period of time, that can be confusing and upsetting to them. Cognitive reactions, such as disorientation or concentration difficulties, are common. You have likely heard people commenting that they're having trouble focusing on their work or are forgetting what day it is. And behaviorally, people may be more irritable, experiencing sleep disturbances, or find that they're just more reactive in general. These all can be typical responses, but if left unchecked, can evolve into more significant mental health conditions, physical health concerns, and/or substance use conditions. The good news is that with awareness, prevention, and if needed, direct support, people can learn to function and manage better. And there are some simple things that people can do right now, such as maintaining a daily self-care routine, having correct and up-to-date information about the pandemic, maintaining connections with others for support, and enlisting community resources for needs. COVID Support VT is here to help address all of these needs, first through our website that includes accurate and up-to-date information about the pandemic, information about stress, recovery, and coping, including a daily wellness plan that people can download to help remind them to proactively manage their stress, apps and websites that promote self-care and management, self-assessment tools to understand one's own experience of stress and their sources of stress so that they can be more calculated in their approaches to managing their stress, and information about where to learn more or who to call to find more support. We also provide a warm line with support counselors available Monday through Friday from 8 to 8 by calling 211 and selecting option 2. The counselors are trained in the FEMA recovery model and provide support, coping skills, and if needed, referrals and warm handoffs to community-based services and supports. This service is free and anonymous, and the counselors are very happy to reach out to people if they are provided with numbers and names. They're also happy to help people in isolation connect with others using conference calling or virtual platforms. We also have a counselor who is Spanish speaking and have access to interpreter services. Wellness groups are available to groups interested in learning more about the pandemic, its effects, and ways to cope. The wellness groups are virtual but interactive and are tailored to groups as needed. There are standing groups on Tuesdays at 1 and 5, but our team also provides wellness groups upon request. As with the support counselors, wellness groups are free and anonymous. You can learn more about these by visiting our website or by contacting our office. Finally, our team works actively to connect people to services in the community. COVID Support VT is managed by Vermont Care Partners, a network of 16 agencies that provide emergency mental health assessments, clinical services, and ongoing supports. We embedded the warm line in 211 purposely to promote awareness of 211 and to have ready access to referrals to other community agencies and programs. Finally, counselors are very interested in providing active outreach and are calling many community-based agencies and providers to educate them about our program. Please let us know if there are people or programs who you believe would be interested in our service so that we can contact them. There are several important numbers we'd like you to have at the ready. As mentioned several times, 211 is a great place to start to obtain information about services and supports in Vermont. For concerns and questions about substance use services and programs, call Vermont HelpLink. For concerns about an immediate mental health crisis, you can text the 24/7 National Crisis Text Line or call the National Suicide Prevention Lifeline using the numbers listed on your screen. And finally, you can contact us. We are here to help, to support, and promote recovery. Please visit our website to learn more, email us, and call us. We're here, and we want to hear from you. Thank you.